Thanks for joining us. Today I'm going to talk about one of the newer minimally invasive treatments for benign enlargement of the prostate called the Rezum system. You may have heard of this. It's a short video, and by the end of it you'll understand why we use this, when we use it, what are the indications, and I'll show you some operative video and the device itself, so stay tuned. Just a couple of words before we start. I have no conflict of interest with the company that make this device. I receive no payment from them. This is not a medical consult, it's an educational only video. This device may not be the right thing for you. You do need a consult with a urologist, and that is because all invasive procedures carry a small amount of risk. Okay, so first up, what is Rezum used for? Well, it's used for benign enlargement of the prostate that happens to many of us as we get older as men. Essentially, the system is a bit like a sink. So there's the bladder, there's the exit pipe from the bladder, which is the urethra, and the prostate sits around this pipe. As we get older, the prostate enlarges and it starts to squeeze on the pipe, as you can see here. And this is an extreme example here. You can see there's so much enlargement of the prostate, it's really squeezing on the pipe, and there's some residual urine left in the bladder at the end. It's not quite as simple as this. It can be prostate alone, it can be bladder problems alone. The two can interact and you can have bladder and prostate problems, but the Rezum is used to reduce the size of the prostate and therefore reduce the block to the outflow of the urine. So who do we use this system for? Well, this is one of the options for treating an enlarged prostate in men who have symptoms that we believe are associated with benign enlargement of the prostate. So the symptoms that can be related to bladder outflow obstruction are urgency, frequency, and going at night more than once. These are generally attributed to the bladder, but they can occur with an enlarged prostate. And then the prostate specific symptoms are hesitancy, so it takes a long time to start, a slow flow when it comes, a stop-start flow, and a feeling of incomplete emptying. So there are a number of different treatment options for these symptoms related to an enlarged prostate, ranging from just lifestyle changes through surveillance, through tablet treatment, and there's a number of different surgical options, of which the Rezum is just one. I'm going to show you some video of what the Rezum does. At the moment in Australia, the indication for Rezum is for men who are not medically fit for TURP, that's the TURP. So this is the Rezum treatment using water vapor energy, so it's completely natural. Here we can see an endoscopic view. So the telescope is passed under general anaesthetic into the prostate cavity, so there's no cutting involved. A needle is deployed into the prostate, and in a controlled manner, water vapor is used to immediately kill off prostate cells. They start to die over a period of time. You can see here this working. So for this prostate, there would be 4 treatments, 2 on each side. The treatments each take 9 seconds, and then a catheter is inserted afterwards. The prostate will shrink away over between 4 and 12 weeks to open up the channel. You can see here in this second video, there's an ultrasound and a cystoscopic view, or a urethroscopic view. You can see there the prostate on the right hand side and an ultrasound on the left. And the transition zone is the area that we want to treat. This is the needle that's inserted into the prostate to a controlled depth. You can now see it in that transition zone, and the treatment starts. Your water vapor immediately starts to work and kill off those prostate cells in that area, and it's very controlled. Each treatment is given for a total of 9 seconds, which has been shown to be the amount that's required to kill off that area of the prostate. When we look at the procedure beforehand, you can see here that these lobes of the prostate, and they look like they're obstructive. We can't prove that, but they look like they're obstructive. At 3 months, you see it starting to open up, and by 6 months, there's a really nice channel through the prostate. So the device itself looks like this. There is a telescope that's passed up the middle of the device, so we can see out of the end. You can see here this device has the needle already deployed, and that goes to a set depth within the prostate, and each treatment cycle takes 9 seconds. The procedure is done as a day case or an overnight stay, depending on your medical condition, and you'll usually need the catheter in for about 3 to 5, sometimes in some people as long as 7 days afterwards. So that is one of the drawbacks. There are some other drawbacks associated with any procedure, and this one tends to be early irritation of the prostate. As the prostate tissue is dying away and moving away from the pipe, it causes a lot of irritation, and this is expressed in urgency, frequency, going maybe more often at night. And I often say to patients that they should expect their symptoms to get worse before they get better. This of course makes sense, and the analogy that I use with patients is if they had a bad knee that needed a knee replacement, they'd be having a lot of pain, they wouldn't be able to walk around properly, they would have the surgery and then be laid up in bed for a number of days afterwards, and slowly over the weeks they'd gradually be able to put weight on that knee. But it takes many weeks, and maybe a few months for things to really improve. So often we find exactly the same with the prostate, that the symptoms will go backwards before they go forward. So there is a bit of an investment to be made in terms of time with this procedure. There are a number of other potential complications associated with this. Bleeding is very rare, although it can occur, urinary tract infection, and sometimes the need for intermittent self-catheterization for a period until the bladder recovers. But this will all be discussed with you when you come and see your urologist. So these are our urologists. All of them would be happy to talk to you about the Rezum procedure. This is Dan Spurnett on your left, Mark Lloyd in the middle, and this is me on the right. Please don't hesitate to give us a call and we would be happy to talk to you in more detail. So these are our details. Please don't hesitate to give us a phone, and please do have a look on the website for further information. Please hit the like button, please make any comments, and thank you very much for watching.